Hello, my name's Kieran. I am one of the exercise instructors here at Scunthorpe Hospital. Today we are talking about joint mobility. Now, there is a difference between flexibility and joint mobility. I'm going to just very briefly give you a quick definition of the two. So, when we talk about flexibility, more often than not, we are looking at how supple or how flexible a muscle is. And we tend to do that in a static position. So for example, if I was to stretch my quadricep muscle, like so, that is looking at how flexible the muscle is. What we're going to focus on is the actual joint itself. And for the first part of this video, we're going to talk about hips. So looking at hip mobility, what that basically means is we have a long bone here called our femur, and the head of our femur sits into the socket. And these drills that I'm going to go through, what they explain is that ability for the head of the femur to articulate or to roll around within that joint space. And these are exercises that you could maybe do as a warm-up when you're going to maybe look at more compound or more functional exercises. For example, squats are quite a common one where you might feel a bit tight in the hip, and so you might do these drills as a starting point to get yourself nice and warm, nice and supple, so that when you then execute your squat, you have greater depth, better mobility, better control. The first one we're going to look at is going to be down on the mat, and we refer to it as 90-90. And what that basically looks like, in a seated position, we're going to try and create 90 degrees and then 90 degrees, hence the term 90-90. If you find that this is a struggle because of how you feel up here, whether you're a bit tight, a bit of pain, discomfort, then you can start this exercise just in a neutral position like so. So what we're going to do, I'll do it from this position first. In a neutral position, we're going to rotate one way and we create then that 90-degree angle. From that position, we roll up and we then go to the other side. Notice how I'm doing these movements nice and slow, nice and controlled. I'm not pushing through really fast, jerky motions. We're looking at nice, slow and controlled moves so we can really work the heads of the femurs all the way around the joint. And you might do this 10, 15, 20 times just to get the hips moving and get yourself nice and warm. The second exercise in this series of hip mobility, we're going to recreate that first move, that 90-90. However, we're going to now incorporate the use of our torso and create a little bit of a lean or a little bit of flexion forward to kind of exaggerate a bit more of a pull around the muscles that are near to the hip. So again, we're going to be in that 90-90 position. So hopefully the hips are starting to feel a bit warmer from what you've just done. We're going to be nice and upright in our torso. Have our hands out to the side. Now, if this is too much of a challenge, if you feel a bit of pressure coming through your lower back, or you find that you can't hold yourself upright, then just pop your hands on the floor. That should feel a little bit easier. From there, we're going to take our torso over the knee where we're pointing. So just a graded movement, coming over the front knee, hold for a second, and then release. So if I do that forward to you, Again, we're 90 degrees, we're nice and upright in our torso, hands out to the side, hands on the floor, wherever you feel comfortable, and you're taking your torso forward. And as you get to that end point, around the hip, the muscles maybe in your bottom, to the side of your hip, you should feel a pull. And that's those muscles just stretching. So now we're combining mobility with that stretch that we spoke about at the beginning. And then of course, you do the other side. So if I go back to side on, now doing this one, nice and upright. Over we go, back. And then you can just keep on repeating that motion. And you might find as the more that you do it, the further you can lean, the more you can tolerate when it comes to that pulling sensation. And again, this is all in readiness for perhaps more progressive exercises that you're going to do in your session. Final exercise in this sequence of hip mobility drills is going to combine the first move, the 90-90, with now an exercise that I've done in a previous video which looks at hinging. So using the posterior muscles, the glutes, a little bit of hamstring as well. And again, this is a progressive exercise. If you find that doing this exercise causes you pain, too much levels of discomfort, or simply the inability to do it, like every clinician, whether it's your physiotherapist, whether it's an exercise instructor, we would advise you to just regress to a level that you are comfortable at. So this exercise would be the 90-90, but when with what's called a shin box hinge. So we're in our neutral position. We rotate whichever way. I'm going to go to the right, or in your view, the left. You're into that 90-degree angle, and then from there, we're going to lift ourselves up. So in real time, we go 1, 2, 3, and down. So there you're firing the glutes, so really squeeze them as you drive up, and then you're controlling the movement down, so you're keeping things under tension for a little bit longer. So again, neutral position, rotate, drive up, control, roll to the other side, up again, hinge, and just repeat that motion. So getting all the hips, the glutes, the hamstrings working, and again just grading yourself, getting yourself as good as you can be, as warmed up as you can be, so that you're ready for your session.